This is a fast summary about first-degree AV block, a common heart condition that often goes unnoticed because it usually doesn't cause symptoms. Let's define it first. First-degree AV block is a condition where there's a delay in the electrical conduction between the atria and the ventricles of the heart. So normally the electrical signal travels from the atria to the ventricles through the atrioventricular node. In a first AV block, this signal takes longer than usual to get through, but it does still make it to the ventricle. This delay is reflected on an ECG as a prolonged PR interval, which is greater than 200 milliseconds. Etiology. Interestingly, first-degree AV block can occur in normal individuals and is often associated with increased vagal tone. The vagal tone is increased by parasympathetic activity. Parasympathetic activity is strengthened by physical fitness. So you can see a prolonged PR interval in athletes. It's increased also in sleep and in vagal maneuvers like Valsalva maneuver and in aging and in some health conditions like hypothyroidism. It can also be caused by medications like beta blockers and calcium channel blockers. Signs and symptoms. In terms of signs and symptoms, first-degree AV block is usually asymptomatic, meaning most people don't even know they have it. ECG description. On an ECG, the key feature to look at for is the PR interval, longer than 200 milliseconds. Here's a normal ECG, where you can see the distance between the P and the R is very short. And here is a first-degree AV block ECG. You can see it is 1, 2, 3, 4, 5, 6, 7 small blocks. To make it simpler, 200 milliseconds is one large box. So if it's more than one large box, the distance between the P and the R, it is considered a prolonged PR interval. Treatment. Generally, first AV block has a benign prognosis and doesn't require treatment. However, in some cases, monitoring might be recommended, especially if the patient has other risk factors for heart disease. So, in conclusion, while first-degree AV block is often harmless and unnoticed, it's an interesting example of how our bodies can have slight variations that usually don't impact our health. Thank you.